If you've come to see me and we check your blood pressure and it's a little bit high and your body mass index is high as well, there is maybe 10 to 20 pounds extra weight on you. We check your blood glucose and it's a little bit high on the borderline. We call it pre-diabetes. We don't call it diabetes yet. And we check your cholesterol and sure enough, there is a little bit high, low density cholesterol, which is the bad cholesterol, and your good cholesterol, which is the high density cholesterol, is a little bit low. So we put all these four things together and we say, okay, everything is a little bit borderline, but at the same time, we don't start any medicine yet. Well, this is the time when you don't want to take things very casually, because you want to remember one word, and that is called metabolic syndrome. So metabolic syndrome is a combination of increased body mass index or increased waist circumference, high blood glucose or insulin resistance, high blood pressure, and then high cholesterol or dyslipidemia. If you have a combination of even three of these four things, then you want to consider that you have metabolic syndrome. And metabolic syndrome is something that needs to be taken very, very seriously, because it puts you at a trajectory for many complications down the road. It is like a wake-up call for you. So what we need to do is, before we even start any medications, we need to start aggressive intervention in terms of lifestyle and diet management, because all of these things, all four of these things can be reversed and the health can be managed back to a normal, appropriate level. So how do we do that? Well, the treatment of metabolic syndrome again is basically zero cost, as long as we intervene early, and it consists of healthy diet, exercise, and stress management, along with sleep management. So what do we do about healthy diet? Well, we need to make sure that you start eating, you start saying absolutely no to sugars, no refined carbs, no processed foods, no junk foods, and incorporate a lot of healthy green vegetables, complex carbohydrates, including carbohydrates which contain a lot of fiber, healthy amount of protein, preferably plant-based protein, and also healthy amount of fats, which should be preferably polyunsaturated fats and monounsaturated fats, and very little saturated fats, and absolutely zero trans fats. Along with that, you need to make sure that incorporate exercise into your daily routine, and not only about 150 minutes of recommended exercise every week, but also incorporate very natural movements throughout the day. So start to incorporate those activities where you just naturally move, because that also improves the metabolism. At the same time, we need to make sure that you start managing your stress, because stress is one of the biggest factors that leads to insulin resistance, and of course weight gain, and then metabolic derangements. Lastly, we need to make sure that your sleep is very healthy and sleep hygiene is improved, which includes making sure that there is no sleep apnea. About 30% of US population has sleep apnea or is on the way to develop sleep apnea. So we make sure that we take care of all of those things and bring all of these four parameters or four derangements and metabolism back to normal, where your health can be restored and you do not develop any complications associated with metabolic syndrome, which include cardiovascular problems, diabetes, and all the micro and macrovascular problems associated with this, which ultimately lead to very poor health and very unfortunate poor quality of life. All right, I hope you enjoyed it.